Welcome everyone to the Michigan HIV/AIDS YouTube channel. We are super excited to bring our second spotlight organization, the Detroit STD Clinic, to you all in the state of Michigan to learn more about what HIV/STI services are provided to the community. My name is Evan Hall, the youth liaison of the Michigan HIV/AIDS Council, and I proudly serve in supporting youth-engaged HIV/STI activities. So without further ado, I will welcome our wonderful guests to talk more about the Detroit STD Clinic.
Good morning, everybody. How y'all doing today? My name is Ari Hampton. I am the HIV case specialist here at the Detroit Public Health STD Clinic. I am also the co-lead elect for Michigan HIV/AIDS Council and also the lead for community engagement as well for that committee.
And hello, everyone. My name is Demetrius Green. I'm here at the Detroit Public Health SD Clinic as your PrEP coordinator. So if you ever have any issues with getting on PrEP somewhere, I think this is the place where you should come. I've been here for about 2.5 years now. It's a really nice atmosphere. I have a lot of success when it comes to getting individuals on PrEP, especially individuals who are identifying as I myself. So if you have any insurance issues, don't be afraid to speak up. Come see us. If you feel like you want to try different versions of the medication to see which is fit for you, come talk to our providers and we'll see what is best for you. We also have like little knickknacks to give away here. Like we have pill containers to keep you on track of getting on PrEP. We also have different types of lubrication because it's important that you exercise when it comes to safe sex and prevention. Remember, there's no such thing as safe sex, safer. So there you have it. And check us out. 50s Canfield. Again, Demetrius Green, I'm out. Okay. I know that's a lot.
Hey everyone, I'm Shira. I'm the medical director here. I've been here for about 3 years, and our goal here is on the macro levels to end the HIV and STD epidemic and the racial disparities that go along with it. So I wasn't really sure if we wanted to talk about what services we offer, or we'll get into that later, whatever you guys wanted.
Well, thank you all for those wonderful introductions. We're just going to start off with some basic questions here, including who you serve and where you serve those people. So can you tell me about the key population your organization serve, and then also how you engage those key stakeholders with your organization?
Yeah, so we serve pretty much all of the community. We are a walk-in based clinic. So that means that we go ahead and it's kind of first serve, first come. Regardless of your insurance, we accept all patients. We only make appointments for the clinic if you are a person living with HIV and you're looking to get into care, or you're currently in care within the Wayne Health System, or if you are a person looking to get on PrEP, which is pre-exposure prophylactics, or if you are currently on PrEP as well, or if you are a person looking for post-exposure prophylactics as well, we will go ahead and book those appointments to make sure that we get those treatments started as soon as possible. As far as the community goes, like I said, we see everybody from grandkids to granddads, grandmoms. We see everyone. We specifically specialize within the LGBTQIA population. So we want to make sure that we're making sure that the community knows that we're a very inclusive space, regardless of your gender identity, gender expression, or racial background or social economic background as well. Did I hit that nail on the head, Shira?
So our next question, go ahead, Demetrius.
Well, go ahead. I'm pretty sure you're going to ask about how it looks behind the scenes, and
Yes, we will definitely get there. But first, I want to learn a little bit more about the mission of your organization and how it aligns with ending the HIV epidemic. I know, Shira, you mentioned racial disparities as a part of that. So can you speak on the mission of the Detroit STD Clinic?
Yeah, so it's a good question. I actually don't know if there is an official mission statement. There should be, but I'm not sure if there is one. But the mission truly is ending the HIV and STI epidemic. And so one of the key things that we see in the data is, let's say for HIV in particular, STIs follow that same trend. Young Black men who have sex with men disproportionately account for new HIV diagnoses and STIs, syphilis, gonorrhea. And further in the data, we see that they have a lower linkage to care. They have a lower viral suppression rate. So one thing that we do here is, because of the people we serve, we know Detroit is overwhelmingly, like, I don't know the exact percentage today, but like 88 to 90% Black. And who comes in here is those are the people we are serving, and those are the people we need to engage more than anybody. So one thing that I do here that is quite unique, and I'm actually in the process of publishing it because I think it is such an important thing, is that we do rapid antiretroviral start same day. So somebody comes in, we do rapid HIV testing. So somebody comes in, they want HIV testing and they test positive, or they tested positive somewhere else and they want to start care. I literally give them, unless there is a contraindication, medication that day in their hand. So my linkage to care, in the linkage to care we do in this clinic with the assistance of, in particular, Ari, who is the HIV case specialist, case manager here, is I'm getting all these people who are in the cohort we see here is predominantly young Black men who have sex with men, getting them into care the same day. They come and see me. I then give them the medication to them that day. We take all the labs, insurance or no insurance, get them on insurance. They come back within a week, and then we follow up care. So the viral suppression rate, which is one of the key ways to end the HIV epidemic, because we know U equals U, undetectable equals untransmittable. So one of the ways is to treat. We have a very high viral suppression rate in this clinic, and I attribute it to same day start of antiretrovirals. And that also goes into same day PrEP, right? So we do rapid HIV testing here, and I can do the labs, but we give the prescription on the day. And then if somebody doesn't have insurance or there's a copay, Demetrius deals with it on the day. So there's not people coming back and dealing with all this other stuff. They can deal with it on that same day and get STD testing and treatment all in the same place. So this is a syndemic, right? STDs and HIV are endemic together. And so here we are dealing and trying to attack all different ways to end the HIV epidemic and work on the population in particular that needs to be engaged the most and they're being disproportionately affected by it.
Ari and Demetrius, you can go ahead and speak on that. I think there were some wonderful points Shira made there. And if you are in the audience there and you are wanting to look up more information, we will provide that in the description below and on our social media pages. So going off of all of those wonderful points, could you speak to the different partnerships the Detroit SD Clinic has? I know it sounds like you are a robust internal organization, but what community partnerships or partnerships with other health facilities do you all have?
Demetrius, do you want to start with the prevention side?
Yeah, I was going to go ahead and take it from there. So with our clinic, we have people who are like outsourced that we really go to. Considering that, I'm the PrEP coordinator here, I always see clients that are in need of something, right? So I want to make sure that there's incentives even outside of what we provide that I feel like not are only tangible, like on the financial portion of it, but as far as like the sexual education behind it. So one of my favorite go-tos is my previous job, which is what'sup313.com. You should definitely check it out for ages 13 to 29, African American. They will receive a $50 gift card for their participation. We focus on topics such as risk reduction, what it means to be stigmatized in this community, what does it mean identifying as a Black male in general? So with these interventions, we hope to have these young adults walk away with some terms of affirmation, sexual health expression, and education. I think that's really good considering that, hey, first you decided to show up here, and now we have another place that can actually continue the work that we do. Um, and with that, also, I tend to give out surveys to individuals who are a little bit over 29 who might qualify, where it could be a study with like U of M, where it's like maybe they have a chance to earn up to about $200 for their participation. Also, Ruth Ellis, shout out to Ruth Ellis, because, you know, especially during the winter, you want to worry about like, hey, how can we keep our client staying warm? Sometimes you notice that you have a client come in and they're wearing a jacket. So, hey, you want to go to Ruth Ellis if you're looking for anything as far as like food or, you know, staying warm or just clothing in general. Um, on the prep end, I feel like I have a special protocol. And since we're on YouTube, I just want to go over really briefly what that looks like behind the scenes. So step one is to get in contact with your prep coordinator. So here's my phone number on the YouTube. That's area code 313-577-1261. But what's also special about our clinic is I know that we have a lot of clients with very busy schedules. So sometimes I tend to work off the clock, just responding to, you know, text messages, which I was going to get into next. I also have a text messaging thread, which I have over 350 participants now, where I can streamline those messages to 350 people in one push of a button, which I think is really successful for our clinic when it comes to just getting a person to restart on prep. Because again, we talked about having a mantra or motto here. I kind of created one on my own when it comes to my clients, and I always leave them with this: hey, we have one person, one pill, one choice. I always want them to know that they have the upper hand when choosing um, their health, their providers, and their situation. So with that, if you want to get initiated with the text thread, you will want to text the numbers 81010, and in the message thread, you want to put the at symbol 50ECAN. So that's at 50 ECAN. It's like a short little abbreviation for 50s Canfield. But hey, you know, again, if you come to our clinic or if you go online, you can also see that that text thread is available. And you can ask questions, set up an appointment, because again, our clinic is focused on getting people on PrEP and ending the HIV epidemic and gearing our focus towards people who are living with HIV. So, yeah.
Great job. Great job. So on the, well, I will say, like, as far as when it comes to HIV treatment side and the prevention side, resources and networking kind of go hand in hand. In order for case management to happen or any type of referrals that Dr. Heiser needs to give out, we need to establish some type of partnerships or relationships with different agencies, CBOs, ASOs, and the health departments as well. So because we're grant funded through MDHHS, we closely work with them to make sure that we're providing all the proper protocols put in place for treatment, prevention, accessing care, and treatment guidelines as far as the STD portion as well. As far as social service support, we also provide, we work closely with 221, I believe, is the code that you can text out to the Detroit Health Department that will provide reliable resources and referrals to different agencies, whether that is domestic violence shelters, homeless shelters, food banks, utility assistance, insurance assistance as well. We work closely with the Detroit Health Department as well to make sure that we're providing those referrals and that they're updated as much as possible. We closely work with different agencies to make sure that the referral process, if they need, if clients need treatment or care, that it's streamlined and streamed a little bit differently and a little bit more efficiently than trying to access a different local health department that's like, hey, call us on special hours or something of that nature. We care a lot about our clients and the community, and we want to make sure that we are approachable And we're building that trust back within the community. So when we think about healthcare, especially within the Black community, distrust has been here for such a long time. And so we want to try to do our part. Representation matters, but it also means that you need to elevate your knowledge points on making sure that you're inclusive, making sure language is modified to be specific for the communities that we're serving, making sure that we are training ourselves, not just one or two staff that work with priority populations, but all staff is trained, because we want to make sure that as soon as you step into the front door, you feel the same way that when you leave out, so that's kind of our motto. And that all comes through the networking portions of working in the community. We have several activists that are on staff that work in the community diligently, myself one of them. So we're always kind of busy, but we're always approachable, we're always open. And we always try to look for different opportunities to make sure that we're providing the best services and care for our clients. Shira, anything that you wanted to add to that?
Yeah, the only thing I wanted to add, I think those are both pretty comprehensive. One thing that I think is really, you bring up Ruth Ellis. So for example, I do trans care for my HIV positive patients, but I don't have the capacity within the setup. So whether my best friends happen to be the two main providers in the rest of the city that do trans care. So kind of within that, whether it's referring to Corktown or referring to Ruth Ellis or referring to Henry Ford, which has a specific trans center. So kind of that, all of these things work together, and knowing the people who are doing it in the community. And I think one thing all of us do is that, in particular, the three of us live in the city, and we know kind of all the key players. So that makes this big difference in when we want to do something I'll go to Ari, this person needs housing, and Ari already knows that there's not that many of them, but the resources that already exist. He's not just he's already so enmeshed in it that we can easily make these referrals. So I had a patient, Dr. Mo out of Ruth Ellis had a patient who was aging out. And so because we're very dear friends in general, she just calls me up, I schedule it's very seamless on coordinating this care, which I think is really awesome. I think it's, I really feel that this isn't just the community we're serving, but this is our community, and we're just trying to make it better, and that people get the care that you would want your parents or family members to get.
Well, it sounds like the seamless synergy of your organization has really prompted not only community initiative, but internal capacity to really involve yourself in the community and make a difference. And so you've tapped into a lot of different referral services you provide, along from housing to trans affirming care. Are there any other specific referral services that your organization wants to highlight?
Oh, DMC. Oh, yeah, they send referrals for people on nPEP. So if people, you don't know what nPEP is, you have 72 hours and from the time frame that you actually had a sexual encounter to take this pill to prevent you from getting HIV. Now, when it comes to the nPEP, if you're insured and uninsured, we still got you covered. Just make sure that you show up. Again, you can call me at 313-577-1261. I really want you guys to get this number. It's being put on YouTube. Why not? So, yeah. Planned Parenthood. Shout out to them. I get more women on PrEP now, and I'm like, wow, that's phenomenal, right? So in the future, with Planned Parenthood getting these referrals, I thought, how can I come up with some incentives for females? And I was just like, you know what? Just hearing their voice. Come on in. I'm recording, so give me a second. Yep, come on. Yep, come in and have a seat. All right. Okay. And this is one of my favorite clients, so, but back to the ladies.
Work never stops.
So just thinking, how can I incentivize these ladies? And I'm just like, well, I have a few things on the list I can't really talk about, but we will make sure that the ladies are covered. Interestingly enough, I'm like, how can we use their voice? So in the future, you will be getting a podcast because I think it's important that you have somebody that's relatable. And I have women that's on PrEP starting out at the ages of 19 to like, believe it or not, 60. So, and I have some pretty juicy topics that I feel like as a overall that we kind of sweep under the rug. Put BDSM on the table, but again, I can't talk about those things. But if you're open to have a conversation about it, I'm here at 50 East Canfield, Detroit, Michigan 48201, and yeah, there you have it. What's going on?
Shira, did you want to add anything?
I did want to say, which I think is really important, and kind of one of the biggest things that I do want to say is everything is relationship building, whether it be with patients, whether it be with myself and Ari and Demetrius. And so like kind of Demetrius and Ari are really linked into the community. And I think like kind of Demetrius giving his cell phone, and if somebody really needs nPEP and it's over the weekend, Demetrius knows he can call me, right? And I can figure something out. Like I just had a medical assistant call me about some family thing, and it was over the weekend, and I'm willing to do that. And so that is, sometimes if we're not open and I don't even have an HIV test to give them, but it's in the hours, I will prescribe the medication. And so one of the key things that we do here is harm reduction model. So making sure it's safe, right? nPEP is really HIV treatment. So yeah, I would like to get an HIV test beforehand, but bottom line is it's the same thing either way. So that type of stuff, kind of having a link into the community, and Ari and Demetrius call me directly, and I'm happy to help out on those times where like you can't come into the clinic. And I think that that's the type of thing that the community needs to know, hey, Demetrius has a direct line to the doctor who can make these appointments or medications or whatever, and I'm happy to do that.
And I did just want to add on to that to highlight the other partnerships. So a lot of our other partnerships do go outside of state. And so just highlighting the efforts and the capability of working with us as a clinic here in Detroit, because a lot of our clients, as we know, transition happens, whether you're negative on PrEP or whether you're positive and you're in care, you still need services regardless of where you go. So if people don't have insurance and they're solely on MyDAP, we're working closely with their state agencies to make sure that they can get the referrals that they need, and we can point them in the right direction. So it's not like when you just move away from us that you can't reach back out to us, and we provide those resources and those referrals for you. We go kind of above and beyond a little bit when it comes to that. But that just goes into the capability of our clients becoming very savvy in how they can make referrals for their own community people as well. So if they have positive partners, or if they have partners that are negative that need to get on nPEP, they can always make those referrals through us as well.
Yep, we have a financial advisor here right in the spot. So he has no excuse. You just got to show up, and we'll take it from there.
Well, thank you, everyone. This has been a very fruitful dive in conversation to what the Detroit STD Clinic has to offer. And we're excited for our audience and those in the community to learn more about the services you provide in detail. Of course, I am encouraging everyone to check out their website, their Facebook, to learn more about what they do. I want to put in there that their hours are Monday through Friday, 8 to 4:30 p.m. And at every first and third Saturday of the month, 8 a.m. to 12 p.m. So really the Detroit STD Clinic is trying to reach the most people possible, and we're really excited to be highlighting them here in our Spotlight Organization series that will be going on throughout the year of 2022. So with that, I just want to thank everyone for having this wonderful conversation and dialogue about HIV STI services in the Detroit community. And for those in our audience, please check out the description below, our social media, and really get connected to care services and prevention. And so with that, we're signing off here with the Michigan HIV/AIDS Council YouTube channel, and we look forward to spotlighting our next organization coming in March. Thank you so much.
Thank you, Evan.